Okay, my name is Heun, I'm a consultant psychiatrist, and today I'd like to talk about EMDR and post-traumatic stress disorder. And interestingly, EMDR is a quite new therapy, and it stands for eye movement desensitization and refocusing therapy. So initially it was more or less by chance that this was found. Doesn't mean that if something is found by chance that it's just irrelevant, but just consider the detection of antibiotics by Ian Fleming, who discovered penicillin. But anyway, so EMDR was discovered by Francine Shapiro in 1987, and she walked around with weird thoughts and negative thoughts, and then she just walked through the woods and looked to the left and right and had some saccadic movements which means the eyes move constantly forward and backwards and follow something, and then swapped side, and then she just felt better, relaxed from her more negative thoughts, and that was then the initial idea for EMDR. Interestingly enough, this relatively new therapy has been found to be effective in PTSD. It has been tried in other disorders, depression, sexual dysfunction, schizophrenia. The interesting part is also that there were different variations of EMDR which are used, changing the side of the gaze, saccadic movements, and it seems to be that the focusing of the attention seems to relieve the stress which is related to memories. So what the EMDR does, it just tries to activate previous memories which are related to trauma and anxiety, and whilst these memories come back or are induced to come back, then the eye movements are induced, and it is then the distraction or something else which changes the perception of the trauma. There have been lots of discussions about the initial efficacy and what it does, and there were ideas about memory change, the imbalance of the brain, left and right, REM sleeping. So all these things are more or less out and proven to be irrelevant. However, one must say that EMDR itself, in different variations, has been proven to do something positive. So that's a bit of a difficulty, and it has also been shown that if you take the eye movement and the saccadic movement of the eyes out of that, it still works. So that makes it a bit more difficult, but it seems to be that this reliving of the old memories under different conditions seems to be a helping tool to improve. So let's say it that way, EMDR is not understood how it works. It seems to work, and it's not just pseudoscience. It's something which works, can help, and it's recommended by many organizations, including the World Health Organization, and I think lots of research is still needed to find out. However, if patients haven't responded to other CBT therapies, EMDR might be worth a trial. Thanks a lot for your interest, and have a nice evening.